Okay, Rita, we're going to do an exam of the sinuses, the nose, the mouth, and the neck. It's a kind of an upper respiratory tract. You have fairly major sinuses above the eye and below the eye, and if they're infected in any way, they're going to be tender. So I can push on the lower surfaces of those two paired sinuses and see if it's tender. If it's infected, it would be tender or had a mass in it or something. So that's all I want you to do is tell me if what I'm doing is tender. And so I'm actually about at your eyelids, and I'm not pushing on your eye. I'm pushing up, and you tell me if that's tender at all. Okay. And I'm kind of doing the same thing here on the top of your teeth where these sinuses are at the bottom. So pushing up there. Is that tender?
No.
Okay, good. Now, in checking your nose, I want to check several things to see how it's working. Let me get the speculum that I'll use for that. The first thing is I want to see how well you're breathing and how well air is moving. So I want you to take your own hand and occlude your right nostril with your finger and breathe in your left side. Okay, and then do that switch and do the other side. Okay, when that happens, we call when things are open in medicine, we call that patent. Now, students often use the word patent. Well, patent is something you do when you invent something. You go to Washington, you want to get a patent. But for medicine, for an opening, patent. So I say both nares are patent because of that. Now I'm going to look in your nose, and I am going to use the speculum. I'm going to insert it, but a very small amount. So I'm going to let you put your head back just a little, and I'm going to brace so my hand is controlled here, and I'm going to crimp your nose just a little bit, and I'm not going to go in very far. I'm looking at the mucosa. Okay, and both sides. And I'm paying attention to the septum, should be midline. I'm paying attention to the color of the mucosa. Now your color is a little bluish rather than pink. Probably means you're having an allergy problem.
Mm-hmm, I am.
And if it was pink, that would be perfectly normal. If it was pustular, that'd be a sign of an infection, or super red, that'd be a sign of an infection. I'm looking at mucosal color, and then if there is a discharge, and I didn't see any in your nose right now, but if there was a discharge, I need to describe it. Is it clear? Is it pustular? Is it bloody? So the character of the discharge. In your case, we just say it's not present. So we want to do all those things for the nose. Now, for the mouth, I need a couple of things. I need a light source and a tongue blade. And I use a tongue blade variable on how I'm looking, but I don't have to, I may not put it in that far. But I start with the lips, and I note that the lips seem moist, and when we see cracking on the corners of the mouth, the term for that is cheilitis. And so if I say there's no cheilitis, it means I don't see any cracking. So I'm going to let you open your mouth nice and wide. Okay, good. Put your head back just a little for me. And I'm going to look, I look at the buccal surface inside and the gingiva and the teeth. All right, now I'm going to let you put your tongue, lift your tongue up so I can see the floor of your mouth. Perfect. Okay, and you put your tongue down and keep opening again. And again, I'm looking at the hard palate and then the uvula, the soft palate and the uvula. And let me say ah. And when you say ah, I can also see past the uvula to the pharynx and see that it's fine. Okay. So what we do is we describe, for the doctor in the room listening, I describe what I'm looking at from front to back, and then I describe in general how it looks. So I'm talking about the lips, the gums and the teeth. I'm talking about the lower surface of the mouth. I'm talking about the tongue itself, the hard palate, the soft palate, the tonsils, and then the pharynx. And I name all of those, because if I don't name them, the doctor doesn't really know what I'm looking at. So I name what I'm looking at, and then I say in a general sense, there was no erythema, which is redness, there was no exudate, there were no masses. There weren't things that weren't supposed to be there. So we kind of name the parts as we're looking, and then we give a general description. Now I'm going to go on to your neck, and I'm going to start by looking at your neck for symmetry, because your neck, you're just going to look straight ahead, just be relaxed, and it should be the same on each side. Okay, and then the trachea also should be in the middle. which should be to one side or the other. So I'm not only looking at the trachea for position, but I'm also feeling it and slightly moving it. It shouldn't hurt. So when I touch your trachea gently, shouldn't be tender, and it should be slightly movable. So it's not tender. Okay. Now, now I'm going to look at the carotids, and the carotids are right here in front of this muscle, and I'm looking for the carotid pulse, which I don't see, but I sometimes can see. But even if I see it or don't see it, I'm going to feel it for its character. So I'm going to touch here, and it's going to tell me whether or not it's. And this time I'm looking for character, not rate. So it's 2/4, which means it's the strength it should be. And then I'm also going to listen to it, because the carotid artery should be open and make no noise at all. So if there's something we call a bruit, and I have to use this part of the stethoscope, and I'm going to listen over that artery for that. And when I'm doing that, I'm going to ask you to hold your breath briefly, because it allows me to hear better. So just if you can, hold your breath for just a minute. And do the same on this side. Okay, good. Now your thyroid is the last thing to check, and I'm going to do that from behind. And your thyroid is actually very low in your neck. It's way down here. So you're going to notice how low my hands are. I'm going to get all the way down to this notch, we call it suprasternal notch, and I'm going to go just above there, inside these muscles, to see if I can feel the thyroid. And normally I actually can't. I just know where it's supposed to be. And you don't have to do anything. You can tell me, well, you can tell me if it's tender. If I, okay, so it doesn't feel enlarged. You say it's not tender, and I don't feel any nodules. So that gives me a screen on the thyroid. The last thing is the lymph nodes. And your lymph nodes are all throughout your neck, head and neck. So I'm going to name each area as I touch it, and then you're going to tell me if anything's tender, and I'm going to decide if anything's enlarged. So a lymph node shouldn't be over about 1/2 centimeter, so that's not very big. It's maybe a little bit bigger than a good-sized peanut. If it's enlarged, then that could be a problem, or if you say it's tender, it can be a problem. So I'm going to start with the very back of your, wrap my hands around your neck, and now I'm at the very back of your head, which is the occiput. That's a region here, so you tell me, well, you don't have to tell me unless it is tender. Right. So the occiput is an area. Then I'm going behind the ear, which we call the postauricular group. Then I'm going right in front of the ear, right in front of what we call the tragus, right in front, that's the preauricular group. Then I go straight down under the jawline, that's the submandibular. Then I go right under the chin, that's the submental. Okay. And then I'm checking 2 groups in the neck, in the body of the neck itself, using this muscle, which is the sternocleidomastoid. I'm checking the border in front of that muscle and the border behind that muscle. I would do each side individually. So this is the anterior cervical on this side. That's kind of a whole region, though. It's not just one spot. And then behind that muscle is the posterior cervical. Okay, I'll do the same thing on this side. And then the last lymph nodes are the lymph nodes above your clavicle. So I'm finding the clavicle and going just above here in that spot to see if they're feeling any nodes. And none more tender.
It's maybe a little tender on this side, but.
Okay. And sometimes it's hard to know if that's due to soft tissue or muscular or something besides a lymph node. I don't feel a lymph node, so that's a good sign. So let me go back through several steps. Since we're using Bates as our primary text, Bates only recommends that we check the maxillary and the frontal sinuses. So your frontal were up above your eyes, and so when I was pushing up, that's checking them, and your maxillary right below the eyes, and when I was pushing up here, that's checking them. There's a couple more sinuses. The ethmoid's right here in the middle, and the sphenoid is 2 inches inside there, but the book doesn't recommend. They're harder to get to or harder to evaluate. So those are the 2 main sinuses that are going to be involved. So that's why we did that. The nose, there's that 4 components to the nose. If you remember, I did. At first, I checked to see if you were breathing comfortably through each side. So that's patency. Then I was looking at the septum, see if it was midline. That's how I described that. Then I looked at the mucosal surfaces of the nose to see if they were inflamed, if they're red, it seems infection. If they're pink, it could be a sign of actually low in blood. And then if they're bluish, that's a kind of a congestion sign that goes with allergy. In fact, yours were that way. And then if you had a discharge, which you didn't, I need to describe it. So, on the mouth, probably the main thing is it's hard to name a full description of everything you're looking at as you go step by step. So that's why I recommend that we just describe what we're looking at kind of from front to back, and then describe it anatomically. Now I'm looking at the mouth, and now the teeth, and now the tongue, below the tongue, the roof of the mouth, the uvula, so the pharynx. So you're describing all that, and then you're naming all that, and then you're describing how it all looked in general. So that's at the end. That's when I said there was no erythema, which is the medical term for redness. There's no exudate, which is kind of the medical term for kind of a pustular reaction. If you had a tonsillitis, for example, your tonsils might be pustular. And then masses is just a general term that there kind of wasn't anything that I saw that shouldn't be there in terms of growth and masses. On the neck exam, probably the most important thing is, again, there are 4 components of the neck exam. So look and feel that trachea first. Do the carotids, including listening. So that's important. And again, we say no bruise is the term, medical term we use. That's when the artery is occluded and it makes noise and it shouldn't. So no bruise. And then the thyroid, those are 2 we do from the front. And then the thyroid was where we got behind. We have to do the thyroid. We recommend thyroid from the posterior position. The reason I emphasize what I did as we talked is the average student, not the average student, but many students will examine the thyroid and their fingers will be way up here. Well, the thyroid's not up there. So that's why we referenced as knots, as suprasternal knots. Get your hands as low as you can and then come up just ever so slightly. Then you're far enough down to evaluate the thyroid. And then the lymph nodes, the issue about the lymph nodes, each one actually drains a certain part of the body. So for example, I'll just go through it briefly with you. If I found lymph nodes here in the occiput, I think there's something going on in your scalp that I need to look at. If I had lymph nodes behind your ear, I would worry about your ear itself. If I found lymph nodes in front of your ear, I'd worry about your eyes, because that's the lymph node chain that drains your eyes. If I was here, these lymph nodes, both here and here, really drain the face. And then the anterior lymph nodes here drain the inside of the mouth and the throat. And the posterior lymph nodes here are lymph nodes that come up in things like mono. So they're not localized diseases, they're systemic diseases. So there's a logic behind why we have it, and there's a logic behind we separate them. And then the supraclavicular, actually, if they're up, we actually worry more about things that are below that line. Things could be either in your chest or even your gastrointestinal tract, which show those lymph nodes. So there's a real logic for why we break the lymph nodes down that way. Okay.